Hi, and welcome to another episode of Punk Rock Politics with John Smith. We're going to get right into the issue of New Jersey having the most cases besides New York, which I've been talking about for weeks. It's pretty obvious that there's a big commute between New York and New Jersey, and even essential businesses bringing food and goods. And the reaction of Andrew Cuomo, the governor of New York, and Phil Murphy of New Jersey have not been enough, or not soon enough, and are still not enough to address this crisis. And there's barely any criticism in the mainstream media. And you go on a search engine like Google, and you search like poor response from Andrew Cuomo, and you actually get articles about how great he is and comparing him to Trump's response, because the DNC is now pushing Andrew Cuomo, who is the opposite of a progressive and actually worked to keep Republicans in power in the state legislature. We're going to get into that in the next video, but for this video, we're going to talk about New Jersey, where I'm from and where I still live, where I grew up and live. And we're going to talk about what's going on in New Jersey, all right? So, let's see here. This is a woman wears a mask and looks at empty shelves in the cleaning supply aisle on March 13th, 2020 at ShopRite Supermarket in Millburn, New Jersey. New Jersey sees largest spike in deaths as governor expands mitigation measures. Governor Phil Murphy on Wednesday ordered all shoppers and retail employees to wear face coverings and postpone the state's primary elections. By Claire Hansen, staff writer, April 8th, 2020 at 2:45 p.m. I'm going to interrupt this article just to say I want to thank... Sorry, I just washed my face. I want to thank Louis B. Massa, who was a great friend and somebody I did an album with called Questions. A mix of jazz, punk rock, and other influences like rock, blues, even classical music, reggae, ska, swing, you name it. But I just want to thank Louis Massa for the chair I'm sitting in. Oh, you can't see it. And he was my best friend, and I hope he's resting in peace. Anyway, so New Jersey on Wednesday saw another record one-day increase. New Jersey on Wednesday saw another record one-day increase in reported coronavirus deaths as Governor Phil Murphy announced expanded social distancing measures and postponed the state's primaries, the Democratic National Committee primaries, the Democratic primaries. Health officials reported 275 new coronavirus-related deaths Wednesday, the highest one-day increase to date, bringing the death toll to just over 1,500. New Jersey is second in the country in total deaths, trailing over only neighboring New York, which also announced its highest one-day death toll yet Wednesday. Murphy will sign an executive order moving New Jersey primary elections from June 2nd to July 7th to increase the odds that they can take place in person, he announced during his daily press briefing. That's actually a good move, if it's safe to do so, because it shows who's actually showing up and voting for people, and you can't just say, and just change the numbers and say this many people voted for Joe Biden. Nobody voted for Bernie Sanders or any of that stuff. So, that is important. That's the right move. Okay. The new date will also give the state time to prepare should it need to conduct the primaries via mail-in ballot, he said. Murphy also announced an executive order imposing new social distancing and mitigation measures. Under the order, all customers and employees at retail stores nationwide will be required to wear non-medical masks or face coverings, and businesses will also be required to limit the number of customers in the store to 50% of the building's capacity. I learned this last night when I went to get some beer in Keyport, New Jersey. There was only 3 people allowed in the small liquor store at a time. We had to wait outside. I had to wear masks. Stores will also be ordered to construct physical barriers between customers and cashiers. They also did that at the liquor store. A plastic guard. Where possible, and to offer designated shopping hours for high-risk individuals. The executive order also bans all non-essential construction in the state, with limited exceptions. Though officials are seeing evidence that the spread of the coronavirus may be beginning to slow, Murphy noted that the fatalities continue to spike and that the number of new cases keep rising. The state added 3,088 new confirmed cases Wednesday, bringing the total to 47,437. out of 7 million people. That's a lot of people. He emphasized that it is time to tighten rather than loosen social distancing measures. The Jewish holiday of Passover begins Wednesday, and Murphy urged observers to celebrate in their homes without others. We have got to stay home and stay away from each other, Murphy said. That is the only way out of this. We are in the fight of our lives, he added. And he's absolutely right on that front. Okay, so now this is from The Guardian. New Jersey. Let me just shift my chair here so I stop blocking the screen. New Jersey. I feel defeated. Inside New Jersey hospitals overwhelmed by COVID-19. Medical staff say they are taking on double the patient loads, working twice their usual hours, and without the equipment they need. Oh, chair's blocking the screen a little bit there. All right. This is from Alexandra Villarreal in New York from the 10th of Friday, April 2020. Inside New Jersey intensive care units and emergency rooms, frustrated and frightened frontline medical staff are taking on double their normal patient loads or working twice their usual hours without the equipment they need. From moment to moment, they face harrowing life and death encounters and constantly risk their own safety to help an overwhelming number of people of a variety of ages and backgrounds who are effectively drowning on dry land from COVID-19. Every single 12-hour shift I work is like nothing I've ever endured, said Lynn, a nurse at Pascack, sounds like a joke, Valley Medical Center in Westwood, northern New Jersey. Pascack. She's got some cack. Pascack. She's past the cack. She's moved beyond the cack to the vag. All right, but this is serious, So every single 12-hour shift I work is like nothing I've ever endured, said Lynn, a nurse at Pascack Valley Medical Center in Westwood, northern New Jersey. She has worked in the field for more than 3 decades and describes the current state of the ICU as a war zone. The patients are sicker than I've ever seen, she says. They can crash in the blink of an eye, then slip into multiple organ failure. Wow. Like many other medical professionals across the U.S., she does not want her full name published. She is afraid of retaliation from the hospital where she works for speaking out on the conditions inside her unit. But she said she feels beat up from working so hard and is alarmed by the grim outcome for her patients. What you see on TV, you could pretty much times by 10, Lynn said, and that's exactly what's going on. New York is the U.S. state worst affected by the coronavirus outbreak so far, but its neighbor, New Jersey, is not far behind. The state had more than 51,000 cases and 1,700 people had died as of Thursday afternoon, a stunning toll on a population of less than 9 million people. Coronavirus cases have been confirmed across New Jersey, but the north, where many New York City commuters live, has been particularly hard hit. That is especially true in Bergen County, which has seen the 4th highest number of coronavirus deaths of any county in the United States, according to Johns Hopkins, and where Pascack Valley Medical Center is located. Save a life, social distance, 6 feet from everyone. Exactly. See that sign right across the river from New York and New Jersey? And in fact, it's in Weehawken, New Jersey. New Jersey Governor Phil Murphy has said he believes the state's curve for new coronavirus cases has begun to flatten. Even so, the fatalities are going up and sadly will continue to go up, he said Wednesday as he announced the deaths of New Jersey residents who were infected weeks ago. And just this, let's be clear, my condolences go out to all the people who are infected by COVID-19 or the novel or the coronavirus. For anybody who has suffered from it, has died, all the people that are scared and don't have the money to pay their bills, the money to pay their bills, anybody who has been affected by this, everybody who's scared by it, and I'm sorry, in a lot of places you can't have funerals because you can't have like any people next to each other, or in some places you can only have like 10 people. Like I heard of a recent person that I went to high school, grew up with, and went to high school with. He passed away, and his family where he was having the funeral was allowed to have 10 people, but that was it. So friends, his close friend and a friend of mine, and we were friends too, just not as close as my buddy is. Anyway, I won't say his name because I don't know if it's appropriate, if the family would want me to. But anyway, it's sad. It was an overdose, which is still an epidemic and getting even worse during crises like these, only exacerbating all of our already existing crises like income inequality, depression, poor health insurance, etc., etc. The climate crisis, which is what is leading to the spread of these diseases. Though there are signs of hope, New Jersey hospitals are still currently struggling. On Thursday, more than 7,360 people. Sorry, I had a brief phone call I had to take real quick there from a buddy. Though there are signs of hope, New Jersey hospitals are still currently struggling. On Thursday, more than 7,360 people were hospitalized in the state because of COVID-19, and healthcare workers on the front line said the vast majority of their patients now have the disease. Though hospital staff are coping to the best of their abilities, Lynn says, just at her hospital alone, it would require hundreds more nurses as reinforcements to be able to deal properly with such dire need. Hackensack Meridian Health, which operates the Westwood facility, did not return repeated requests for a comment for this article. An emergency room doctor in northern New Jersey, who also feared retaliation and asked to remain anonymous, said the hospital has a similar caseload to Elmhurst Hospital, one of the hardest hit in New York City. Before the outbreak, it wasn't unusual if one patient lost their pulse and needed chest compressions to stay alive. But during a recent shift, he was faced with 3 such situations back to back. For whatever reason, folks are holding up, and then almost before your eyes, over the course of minutes to an hour, will suddenly decompensate in a way that few things that we deal with in the emergency room do, he said. He describes how one 48-year-old patient's oxygen levels dropped catastrophically low. The doctor rushed in without full personnel protective equipment, or PPE, so he could insert a breathing tube into the man's airway, even as his patient was coughing up the virus. God, these people are heroes. An hour later, the doctor was on the phone with his patient's daughter to update her on her father's condition. He was grateful he had avoided a much more difficult call by making the choice he did regardless of personal risk. The choice is stop and put on all your PPE, which can take a minute or two, or get on the most important stuff and get in there and save his life, the doctor said. Not to be dramatic about it, but that quite literally was the choice that I felt I was faced with. In another case, a 400-pound man with COVID symptoms started throwing punches at hospital staff as his breathing began to fail. His carbon dioxide levels were too high, and he likely didn't know who he was or where he was, much less who other people around him were. The doctor had no idea how he and other staff members would help the man without risking exposure to the disease themselves. He said he thinks his hospital and New Jersey state government are doing the best they can in the circumstances, but is frustrated with the federal government, and especially Donald Trump, for minimizing the disease seriousness and creating what he believes are unrealistic expectations around available resources, as well as how long this pandemic will last. All of that, as an emergency room doctor, has made my work harder, not easier, and it's made it harder in ways that are very tangible, he said. He describes walking into a shift weeks ago when he quickly realized that within 2 hours of the president going on television and saying testing was readily available, even though it wasn't, somewhere between 40 and 60 patients had flooded into his emergency room looking for tests. Tests haven't been the only tools in short supply. Lynn said she and her colleagues have been using the same face shields for up to a week, and they're out of bleach wipes to disinfect their once disposable equipment. Unbelievable. They're one-time use, and up until a month ago, I would have been disciplined for using them more than once, Lynn said. Jane, another registered nurse who works in the ICU at Pascack Valley Medical Center and asked to only use a nickname, wrote in an email to The Guardian that nurses are covered head to toe in whatever PPE they can find, but there still isn't enough. Jane said she and her peers use one N95 mask per 12-hour shift, and they're putting the masks in paper bags to reuse even after they're assumed contaminated. Amid the scarcity, employees have started buying their own PPE, she said. Jane described desolate hospital halls juxtaposed with a chaotic ICU where patient monitoring alarms blare, signaling another person's decline. She laments the lack of staff and hazard pay, doubled patient loads and risk of infection. But after her shift is done, what stays with her is how many young, relatively healthy people are dying. And dying alone because their loved ones are not allowed to visit for fear of spreading the invisible killer. I feel defeated, she wrote. I also feel helpless because we are working so hard, trying every treatment modality that we can, and patients are still dying. Sometimes I cry driving home from work. I can't help but think about patients and their family members who weren't able to be with them or speak with them before they died. Excuse me, this is just kind of emotional. So you heard the doctor blast Donald Trump, which is absolutely right. The president has treated this like a joke. We could have stopped this at the federal level. We could have instituted measures to greatly curb this. So those deaths are on Donald Trump and his administration and anybody in his administration who was pushing to say things like we shouldn't even close business, or we should open business sooner, or religious congregations should be able to get together for Easter, or all this crazy shit that is literally causing people to suffer and die, hurting our economy, etc. This is the fault of the Trump administration. This is also the fault of Nancy Pelosi, Chuck Schumer, and others, including Bernie Sanders and AOC, who didn't fight hard enough for a better stimulus bill, and to push for the production of more needed medical supplies, instituting more nurses, doctors, etc. This is what happens when you don't have free college. People don't pursue their dreams because they can't afford to. They can't go to school, or they can't finish school. So what happens? You have less doctors. You have less nurses. You have less medical staff in general. Assistants, etc. You have less essential services a society needs to run, which is why you need socialist input, socialist policies, left-wing progressive policies, American policies, whatever you want to call them. The ones that stop the intrusion of capitalism from ruining our society. Just absolutely horrible what's going on in New Jersey and around the world. And this could have been avoided. Look at places like South Korea, which instituted like social distancing measures and made everybody wear masks. They have like 87 cases. They acted early. And they acted appropriately. Not what those in power in our government have done. Shameful. I don't think Joe Biden would have done much better of a job. I think he would have done a better job, definitely. I don't think they would have slashed the CDC quite at the level as Trump or other important organizations. But still, I think they would have been woefully underprepared. And Joe Biden told everybody to go vote during a fucking pandemic in Illinois, Florida, and Arizona. Those elections should be invalidated. The rest of them should be investigated because the exit polls don't match. Look it up. The raw exit polls, way off. And who benefited? Biden. And in one case in Massachusetts, Bloomberg. Biden didn't step foot in Massachusetts, and he clearly lost that election to Bernie Sanders by a landslide. That's what all the polls were saying for weeks and months. Biden stole this election, and the DNC helped him steal it, just like 2016 with Hillary Clinton. And he's a worse candidate than Hillary Clinton. He's got dementia, for Christ's sake. And he's a rampant liar. And is a conservative. A crazy conservative. More right than Donald Trump on many issues. Broke all his campaign promises with Obama. The two Obama administrations he was in. Just a deplorable person. And it's really a shame that Bernie Sanders dropped out. You could still vote for him. And you should. Based on policy alone. And support these policies and support somebody who's at least somewhat fighting the system. But a political revolution is not one where you drop out of a race when the other candidate clearly would lose to Donald Trump and you claim that's your biggest fear. Just because you're afraid of being labeled Ralph Nader. You should be honored to be labeled somebody who fights for democracy like Ralph Nader or Bernie Sanders. Stick with me here on Punk Rock Politics, because after I read this article, we're going to read a really important article from, I believe it's Jakarta News. And it discusses what some of the states have done more successfully, like California. And let's read this and see how Murphy has responded in some cases. This is an older article, but it's very important because it highlights some missteps by Governor Murphy. It doesn't really critique them because it's not really investigative journalism. It's mainstream media. And I had a video of NJ.com pulling a favorable poll to Bernie Sanders after the last debate which Joe Biden has chickened out of the next debate, which was promised by the DNC and all the candidates involved. And since it's just Bernie Sanders and Joe Biden were left, and you can still vote for Bernie Sanders, even he's only suspended his campaign, but he hasn't ended his campaign. But he's not advertising, he's not fighting Joe Biden, and he's not pushing for Joe Biden to debate him, which is absurd, especially given the fact that Tara Reid has filed sexual assault charges against Joe Biden, which I'm going to cover in a subsequent video after this. I got at least 2 more videos I got to do before I have to run out and do some stuff. All right, so 9 things we learned about New Jersey's corona. Oh, make sure you subscribe to Punk Rock, my channel, Punk Rock Politics on YouTube. Subscribe to this channel and double click the button so you get the little parentheses around the bell so you get alerts, and or click all if you're on a computer so you get alerts when I do new videos. That's important. And go to Punk Rock Politics. Go to patreon.com/punkrockpolitics and please become a patron and support this channel. You can start for being a patron at the lowest tier is just $1 a month. And if you don't like what you're offered, you can cancel before the first of the month and not even be charged. So go for it. All right. Please support Punk Rock Politics so I can grow this channel, do more videos, and make this a full-time thing. 9 things we learned about New Jersey's coronavirus response from Governor Murphy's live chat with NJ.com. Governor Phil Murphy sat down Friday afternoon for a live interview. Oh, excuse me. Let me tell you who did the article. This is by Brent Johnson, New Jersey Advanced Media for NJ.com. Governor Phil Murphy sat down Friday afternoon for a live interview with NJ Advanced Media about New Jersey's response to the coronavirus outbreak, just after he announced confirmed cases of the illness have risen to at least 890, with 11 deaths, and said more business closings are on the way. Here's a look at 9 things the governor discussed during his 13-minute chat on NJ.com's Facebook page. Number 1, it's undetermined if New Jerseyans will be ordered to stay home. In the last 24 hours, the governors of California and New York ordered people to stay home, except for essential workers and essential travel, to help stop this virus's spread. Murphy did not go as far Friday, though he did say he is expected to order all non-essential businesses in New Jersey closed on Saturday. To be determined, the governor said, as to whether he will order people to stay at home. But it'll be no gatherings, non-essential businesses not open. There's no amount of aggressiveness that's too much. He says as he doesn't order people to stay home except for when getting supplies and food, or institute a government-run organization that delivers people food so they don't even have to go out. Alcohol and other goods. Unbelievable. So nothing's too aggressive except he's not being aggressive enough and it's causing the spread. This is an old article, so we have the most cases in the country besides New York. Murphy has already closed Murphy has already closed all public and private schools, and the shutdown of casinos, dine-in restaurant service, theaters, gyms, and indoor shopping malls, and a suggested curfew from 8 p.m. to 5 a.m. He also has limited public gatherings to no more than 50 people and repeatedly called for people to stay home if they can. 50 people? That's how this virus is spreading. What incompetence. Make sure you call your governor's office and call your state legislature and call your representative in state government and demand that the governor take this more seriously and institute measures that will help us. And one of the ways we could do that is actually spending government money and government employees and working with nonprofits and private sector to make sure that we stay safe and make sure we provide people with the services and the goods that they need. And we're not doing that. Unbelievable. He also, I want to read that again. Governor Murphy also has limited public gatherings to no more than 50 people and repeatedly called for people to stay home if they can. Other businesses have so far been allowed to stay open as long as they adhere to social distancing guidelines, which they don't, and close by 8 p.m. But that appears to be changing Saturday. By the way, be loud when people don't adhere to social distancing guidelines. Say something. Tell people to stay away from you. Be loud about it if you have to. And tell people how serious this pandemic is. And make sure people understand the seriousness of it. Murphy did not explain what non-essential means, though he's unlikely to close grocery stores, gas stations, and pharmacies. In many respects, California did something that sounded like it was a lot more significant than we've already done, Murphy said. Frankly, we've probably been as aggressive as any American state, but we're going to tighten the screws further. We have no choice. Unbelievable. Number 2, New Jersey's number of positive tests will go up, but that may help. Murphy said Friday the state may be weeks away from the peak of the number of cases, but he said he did not know just how many cases the state is projecting. I don't have a crisp answer in terms of how bad, the governor said. But the numbers are going to go up, and they're going to go up meaningfully. Murphy said that's partly because the state is seeing more community spread and testing is expanding rapidly. The state opened its first government-run drive-through testing center in Bergen County on Friday and is expected to open a second in Monmouth County on Monday. We have a lot of commuters to New York and Monmouth County. For those worried by the spike in cases, Murphy said more testing is a good thing. The more we know, the better we'll be in terms of our ability to deal with this, he said. 3, there are no numbers on how many people have recovered from the illness already. The state has not provided numbers for how many, if any, New Jerseyans inflicted with the virus have recovered. Murphy also didn't provide a number, though he said a lot of folks are not hospitalized. Particularly those are younger or don't have underlying health issues, he said. But the folks who are getting badly, there's no understanding how bad this could be. Daycare centers are remaining open for this reason. Despite the rash of school and business closings across the state, Murphy has faced criticism for keeping child daycare centers open. The governor said they remain open because some healthcare and emergency workers with children need a place to bring their kids. We've got to be really careful that we don't tilt the machine completely out of whack, Murphy said. We need some place for parents to go with their kids. He said officials are watching that very closely. Murphy also announced Friday he is closing adult daycare centers in the state. Oh man, they're vulnerable people. What they need is to have government act and move into these places and make sure social distancing is taking place and there's enough equipment. But that's not what they're doing. They're trusting daycares who aren't trained for this to watch people's children. That's absurd. And it's not just for hospital workers. It's so a bunch of people can profit off this. And so there's massive grocery store chains and other businesses that are still operating. And those people need a place to keep their kids, which their wage barely covers the cost of daycare. The state, or doesn't. The state still needs healthcare equipment. New Jersey remains short on personal protective equipment for healthcare workers as they confront the virus, Murphy said, but officials are working to secure more supplies. He said the state continues to seek assistance from the federal government while also buying new equipment and getting donations from private companies. We're turning over every single stone, the governor said, but the fact of the matter is we don't have enough. If you were turning over every single stone, New Jersey would start making these devices and take over businesses and have them make these devices. But you're not doing that, are you, Governor Murphy? No, Phil Murphy, you're not doing that. And Donald Trump's incompetence and this poor national, they're not using the Defense Production Act and forcing companies to make all the supplies we need. And even when they do have cooperation with companies, they're giving contracts to GM, like giving them money to profit. It's absurd. Trump administration's response is a joke, and so is Governor Murphy's. And he's talking out of his rear end. 6, here's where to call if you see a business violating the state's orders. If you discover a business remaining open or violating another of Murphy's orders, he said you can call 1-800-222-1222 or call 211 or text NJ-COVID to 898211. You can also visit nj.gov/health. Everybody's got to be compliant here, Murphy said. Don't expect to go through with your elective surgery. Murphy did not say he is ordering people in New Jersey to stop getting elective surgeries, but he said, I don't think even if they want to do elective surgeries that they're allowed to. The governor noted how he had a cancerous tumor removed from his kidney March 4th and recently did a follow-up with his doctor via his wife's iPhone. The good news is it looks good and I'm recovering, he said. He also said he was struck by something else his doctor told him. He made the following statement, which kind of took me back, Murphy said. I had cancer. It had to be done within a certain amount of months, but he said almost certainly if I were up now for that operation, it would have been deferred. Wow. So people with diseases that could kill them might not be able to. That's how bad our government is responding to this, and how how badly we need free public education so people can become doctors, attorneys, politicians, whatever they want to do. Teachers, and we need to pay teachers more. Whatever. We need to pay everybody more, mostly, except big wealthy CEOs and stuff like that. Okay. 8. There is help if you can't pay for your rent or mortgage or are out of work. The state is enacting numerous laws and putting other policies in place to help New Jerseyans affected by the sudden closing of businesses, Murphy stressed. He's He's noted he's given a 2-month extension on driver's license renewals, ordered that foreclosures or evictions be halted, and is urging banks to make sure they give people every break possible. I want landlords to hear us loud and clear. This is the time to give people a break, Murphy said. Oh, you want them to? Oh, if you really wanted them to, wouldn't you force them to halt rents? And for landlords that really can't afford to not get the income, help them and give money to people who need it? No, you're not doing that. You're asking them nicely. You're asking banks to give people a break. No, order them by law to give them a break. Do your job. Call your governor. Call your state representatives in New Jersey and other places if they're handling this response as poorly as Governor Murphy is. He also noted that New Jersey saw a 20% jump in unemployment requests last week, and that another 15,000 applications for unemployment came in on Monday alone. Murphy emphasized that the state had two choices: ignore the virus, have enormous amounts of fatalities and people sick, and have an economic cratering, or get out ahead of this, flatten the curve, limit the fatalities, number of people sick, but also still have an economic meltdown. The governor said, I'm going to take door number 2 every time out. Murphy also noted that he and the governors of New York and Connecticut are asking the federal government for at least $100 billion in direct assistance to cover lost revenue and other costs. 9. You still won't have to pump your own gas amid the pandemic. No, Murphy said he hasn't considered ending New Jersey's status as the last state in the nation that allows only full-service gas. That has not come across my desk, he said, and that is not a consideration at least at this time. Murphy said he expects New Jerseyans to have their gas pumped for the rest of the time, which is actually horrible because to practice social distancing, you shouldn't have people going to and from cars and taking payment. They should let people do it themselves and use their card or leave cash in a place and be safe. But they're not. Now, I'm glad you stuck with me, and this is an important article from the Jakarta Post. And it says, Coronavirus, why have so many died in New York? This is from Saturday, April 11th, 2020 at 3:03 p.m. Look at this. Sisters Sylvia R., Stephanie Falcomer, and grandson Peter Henry hold a socially distant 94th birthday party in their driveway for their mother and grandmother, Marcella Falcomer, who came to America from Italy in 1955, as they say hello to their relatives on a Zoom video conference call during the outbreak of the coronavirus disease, or COVID-19, in West Nyack, New York, U.S., April 5th, 2020. New York has more coronavirus cases than any country and accounts for around half of all deaths in the United States. Why was it so badly hit, and could its leaders have done anything differently? Was New York more vulnerable? As of Friday, New York State has almost 160,000 confirmed COVID-19 infections, more than Europe's worst-hit countries of Spain and Italy, and over 7,800 deaths. Governor Andrew Cuomo has said repeatedly the density and number of foreign visitors made New York City, which has almost 93,000 confirmed cases, an ideal breeding ground for infectious disease. America's financial capital has 8.6 million inhabitants. There are 10,000 people per square kilometer, making it the densest city in the United States. Millions of commuters brush up against each other on its packed subway system every day while keeping distance on it. Sometimes narrow sidewalks can be difficult. New York City gets more than 60 million tourists a year and is the entry point to America for many travelers, meaning anyone carrying the virus is likely to start infecting others there first. American geneticists estimate that it started spreading there from Europe in February, before New York's first confirmed case on March the 1st. The Big Apple is also characterized by massive socioeconomic inequality. Overcrowded, deprived areas, particularly in the Bronx and Queens, where many people already suffer health problems and lack medical care, have experienced the highest rate of infections. New York City had all the preconditions that would support the idea that it was going to be very hard hit, said Erwin Redlener, public health professor and expert in disaster preparedness at Columbia University. Did officials underestimate risk? On March 2nd, as the state's second case was confirmed in New Rochelle, just north of New York City, Cuomo said the healthcare system was the best on the planet. We don't even think it's going to be as bad as it was in other countries, he added. After much hesitation, New York City Mayor Bill de Blasio announced the closure of public schools, bars, and restaurants from March 16th. I did a video on this. Actually, it's unfortunately separated into two videos. And the first video is where I discuss how teachers and students called out sick and organized because Mayor de Blasio was trying to leave public schools open, saying that this is how we feed kids, and we need people to watch kids while people work, instead of, providing those government programs again and actually doing something to curb this disease and save people and help people who are suffering economically and with their health, or scared to get sick or get others sick. The governor ordered all non-essential businesses to close and residents to stay home a week later on March 22nd. Experts hesitate to say that they waited too long. The mayor and the governor were being pushed and pulled by two opposing forces. One was saying we have to close schools and restaurants as quickly as possible. The other saying there were lots of economic and social consequences of shutting down everything early, said Redlener. Everyone was getting mixed messages, including from the federal government, from President Donald Trump, he added. Have other states reacted better? California, America's most populous state, is often cited as a good example for the speed of its response to the outbreak. Its confirmed cases as of Friday were just 20,200 with 550 deaths. California has like 34 million people. Look at the death toll in New Jersey. It's unbelievable. This is what progressive politics gets you. Or more progressive politics. There are still things that aren't progressive enough in California, but this is generally what progressive politics gets you. It keeps you safe. It keeps you secure. It prevents crises and keeps you secure in times of crises. One thing that I think is significant is that 6 neighboring counties got together and issued the same confinement order for all 6 counties, and they did it early, said Megan McGinty, associate at School of Public Health of Johns Hopkins University. So this is counties coming together, county government, and county officials, and probably nonprofits and private sector officials. And good job, California. This is what we should have done, and this is what we should do now. There was consistency, as opposed to New York City taking one measure and Westchester County taking another and Long Island taking another, she told AFP. 6 days passed between New York's school closure order and its order confining residents to their homes. In epidemic terms, 6 days is light years and can really make a difference in the control and spread of the epidemic. So I think it is possible to say that perhaps in retrospect New York waited too long, said McGinty. Is anyone to blame? When the crisis passes, the blame game may begin. Democrats Cuomo and de Blasio deplored for weeks the Trump administration's delay in getting tests to states, which to this day are still not arriving in sufficient numbers. The New York officials also targeted the federal government for dragging its heels in implementing emergency powers to manufacture life-saving ventilators, using the Defense Production Act, with which Bernie Sanders was pushing, which we should have used. And the mainstream media is acknowledging that Bernie Sanders' response to the coronavirus is correct and we need these measures, including people like Joy Reid, who's a joke, who said we need Medicare for all, which she's right about this time, finally, after bashing it for very long. With the toll far exceeding the numbers killed on 9/11, Phil Murphy, the governor of neighboring New Jersey, which has also been badly affected, has called for a commission similar to the one set up to investigate the September 11th, 2001 attacks. The warning signs were there. What happened? If you don't know the answer, how are you going to make sure it's not going to happen again, Cuomo asked Friday. Given the number of dead and millions of unemployed, we have a moral obligation to study this pandemic, concluded McGinty. Absolutely. We need a commission to investigate all public officials, including Governor Murphy and Cuomo, who are acting like it's not their fault that this spread, and it is. So call Governor Cuomo and Murphy if you're in the state and if you're not, and tell them that they did not react properly. And Governor de Blasio, who I often like. But this is terrible. What they did not respond to this properly. California did. Other places did. Korea did. Anyway, thanks for joining Punk Rock Politics. I got to pump out another video or two. Share them, and then get out because somebody's waiting on me. All right. Thanks. Make sure to subscribe. Go to patreon.com/punkrockpolitics for early access and updates. I got to update a lot of my videos from YouTube and put them on there. That will be coming by this week, hopefully tomorrow or the next day at the latest. I will have all those videos and give you some early access and extra content. But there's already some access that's only for Patreon subscribers. The first membership is just $1 a month, and if you don't like it, you can cancel before first of the month and not even pay. So please support Punk Rock Politics. I'm giving you the news others aren't, and the commentary others aren't. Hold your governments accountable at every level. Thanks for joining. Be safe out there. Practice your social distancing. And I'm with all those people that have suffered and died from this disease, and their families and friends and communities.